Welcome everyone to our first concurrent session, Community-Informed Behavioral Health Crisis Services, presented by our wonderful panelists, Brittany Deliso and Latife Amato. Brittany Deliso supports individuals navigating, hello, welcome to the stage, supports individuals navigating behavioral health challenges within under-resourced systems. With experience as a mental health therapist and a systems strategist, Brittany is dedicated to creating more efficient, person-centered services. As the project manager for a new behavioral health stabilization center, Brittany is focused on ensuring that community voices shape the program from the start, with the goal of reducing re-traumatization and fostering true healing. Born and raised in Mexico, Latife Amato is a mother whose experiences as an undocumented immigrant deeply shape her perspective on belonging, equity, and racial justice. Now based in Eugene after living in Los Angeles, she is passionate about fostering cultural shifts related to equity and bringing diverse communities together to co-design systems and policies. Her goal is to contribute to the realization of a multicultural democracy. In her free time, Latife enjoys backpacking, baking, traveling, bouldering, and gardening. Brittany and Latife, I'll let you take it over.
Thank you.
Welcome. Thank you so much, Lauren. Welcome. Bienvenidos to our session, Community-Informed Behavioral Health Crisis Services. We are so grateful for the opportunity to share a bit about our equity-centered process in part of the Stabilization Center work and to share some ideas and lessons learned. As Lauren mentioned, my name is Latife Amado and my pronouns are she, her, ella. My dominant identity at this moment is that of being a mother to two very young children. By training, I am a scientist, educator, and a leader development coach and facilitator. And I was born and raised in Mexico, which really forced me to navigate an incredibly complex system, being undocumented most of my childhood and part of my adult life. And, really trying to pursue a higher education. So my identity definitely shapes the way I view the world, the way I view this work, and how I navigate, as well as my healthy criticism of existing systems. In my current role as equity officer at Lane County, is really serving as an advisor to our executive team and to our programs.
Yeah, thanks, Latife. And just to add a little more to my introduction as well, again, Brittany Deliso, I use she, her pronouns. I am a wife and a mother and trained as a clinical mental health therapist. My work has moved from direct care more towards supporting system and overall system improvements within the behavioral health sector, with the primary goal of really reducing the burden on those that are seeking services by enhancing the service delivery offerings through the system itself. And have found that the system, the healthcare system, really has become my client in many ways over the last years. And currently working as a behavioral health project manager, as mentioned, and supporting the expansion of behavioral health crisis services throughout Lane County here in Oregon. So I would love to kind of talk through our agenda for the hour that we have with you all. We are really highlighting a specific project that Latife and I have had the chance to partner around, using it as somewhat of a case study or case example of how to truly integrate, collect and integrate community input around a new behavioral health program. So we want to talk first just by setting the stage around what the behavioral health crisis program is that we are discussing, some context for you all, and then explain how we went about from the very beginning, establishing and grounding the work and the program itself in an equity lens, looking at a true foundation for how the work from the very beginning and throughout the duration of even operating services can be grounded in community voice and equity. And then we'll give a more specific example of how we have pursued this through offering a community-wide survey and get into the gritty details of how we have assembled that survey, distributed it, and navigated the analysis of the survey results with an equity lens. So talking about some of that survey analysis and then the outcomes, what actually has been implemented and is being implemented in an ongoing fashion throughout the duration of the program. And then lastly, want to share just some learnings, what we've celebrated with success throughout this process, and then of course what we have identified that we could do better and will do better next time, and want to share that with you all. And there will be some time to address some Q&A at the end of our conversation today. So as I mentioned, just wanted to give you all foundation and kind of context for the rest of what we'll be discussing. So a primary function of my role as a behavioral health project manager at this time is supporting the development of a new program and new facility here in Lane County in Oregon. So we're in process of standing up a new 24/7 behavioral health crisis stabilization center. And this program is intended to serve all ages, all insurance status or no insurance, regardless of citizenship status. It's really meant to be an open door for all folks that are navigating a behavioral health crisis. And the intention is really to provide an alternative to the emergency room and to the jail, which unfortunately right now, those are really our two options for somebody who is navigating a behavioral health crisis, youth or adult, if they need to go somewhere for care. And we recognize that the system has not done well, that that's not sufficient. So we're looking to provide a third alternative that is really centered around trauma-informed approaches and specifically behavioral health trained staff. What's cool about this program is that it is a fairly new level of care within the state of Oregon. I think even across the country, there's new versions of these services standing up, kind of looking like even a behavioral health emergency room, if you will. And so different states and different areas are doing this in different ways. Um, but what's cool about being a part of something that's new statewide is that we get to have conversations with our Oregon Health Authority around rules and regulations and the actual infrastructure that will support this program and help sustain it, which means we get to have a say somewhat in what it looks like as we're conversing and coordinating with other counties as well, which really gives us the opportunity when we talk about how work can be community informed, to not just check a box, not just invite feedback around decisions that have already been made, but actually invite community members to be front and center in informing how the services will look and how they will operate in a way that's responsive to the needs of those actually seeking care. Within this project specifically, early on in the work, we were given an opportunity to really practice some transparency and bring this to the front. We'll jump back to the previous slide just for a minute longer, just to explain a little bit more of kind of the foundation for our why and what really thrust us into a more community focused project. And that's where we were identifying where to locate this facility and found what seemed like a dream location right in the center of our largest town in our county, really easy access for a lot of folks that may be using the services. And as Lane County went forward in purchasing this building, we received some feedback from community members, neighbors to this facility location, really sharing concerns that maybe we hadn't thought everything through and that we had not consulted with our community about something as foundational as the location. So this was difficult to navigate. We had to do some repair work, but why I bring it up and what it did for the project is really position the work in a very public facing, transparent position right out of the gate. So we were forced to invite community eyes on the work, and therefore had the opportunity to invite community voice to then inform the work from there on, after we kind of made a misstep and had to pivot, and then have taken that position of transparency and really prioritized that throughout the duration of the project. So that's around when I came on into my position and was beginning to ask questions around how can we do this meaningfully? How can we avoid checking a box and genuinely solicit true impact or input that will impact the project? So I was given this tool that y'all had a sneak peek at for a second here as just a guideline to begin to understand where the project, where our team, where the work currently fell along a continuum of engaging the community and where we want to be. Um, and with a simple self-assessment, I would say we were probably somewhere between the ignore and the inform column, some of our work and some of our true intentions really landed us in wanting to keep our community informed. We possibly even had a few outlets around consulting with community members, but it became clear that we needed some mechanisms and pathways to move the work further to my right, to the point where we're collaborating, and maybe even getting to the point of empowering and deferring to the expertise found in our community members through their lived experience. So I used this as a guide, just kind of, I have mental health training. I don't have community engagement training. I was just trying to understand and maybe can relate to some of you all on the call of like, I know that we need to solicit the voices of those who have lived and survived through this system, but I don't know how and I don't know where to start. So this kind of helped me orient to where we were. And out of this, I created some loose framework, some sort of guideline for myself and to kind of direct our team on how we could begin to pursue this and make community voice really a prominent feature in this project. So I set this somewhat linear framework with three categories of wanting to highlight community wide listening, really broad brush, trying to collect as many voices as possible. Looked at more focused population input with more directed and specific inquiries, and then tried to brainstorm kind of an ongoing mechanism, knowing that we want community voice to inform this project, even when it's up and running, to provide ongoing input. And so with the community-wide listening, what that has looked like so far, all three of these are ongoing and often simultaneous. But with community-wide listening, what that looked like was we hosted 4 topical listening sessions. The topics were around informing the program design, informing the facility, the building and infrastructure design, informing how this program operated within the broader community and what coordination and collaboration would look like. And then we had a catch-all topic for what did we not think to ask you about that you all would want to inform us of. And the intention of these listening sessions was to get a pulse from our community on what they actually care to speak about. We could make some assumptions on what, maybe everybody we assume would really care about the aesthetics and the paint color, but maybe they care about other aspects and we wanted to know what mattered. And that's where we would focus our future efforts to really inquire about their perspective. In addition to those scheduled time sensitive listening sessions, we have an ongoing comment box, question box on our website that's always available. Anyone from the community can access it and it's been promoted on occasion for either comments or questions about the project. And then with the focused population input, that has included kind of as needed some focus groups to get some intentional and specific feedback to help move some of the larger efforts along. But mostly the focused input has really come from our survey, which is really what Latife and I will be spending the rest of the time today talking about, because this was the opportunity where we were able to most closely partner with our equity team and really pursue a well-rounded, equitable um, process to solicit this feedback. And then for ongoing consultation, we do have individuals identified with lived experience serving on some of our more formal committees that are helping to guide and govern this project from day one. And then we have plans to stand up a formal consumer council once the project's open to have that outlet for feedback, to continue to inform the work as we go.
So our collaboration started between Brittany's position and my position really by acknowledging what we knew to be really true about existing community engagement processes, not just here at Lane County, but just sort of what we know overall about the existing systems. We know that they're not designed to be inclusive and they often lack the authenticity, and authenticity really meaning the voice can really drive change. So some of the emerging themes that came again from previous county community engagement efforts and really overall that we wanted to try to disrupt were first the illusion of voice. We see this a lot where we ask questions and we put out surveys, but those voices don't often drive the change that we're, around the things that we're asking. So we wanted to really offer authentic feedback opportunities. And that started by being really clear from the very beginning on the places that community could actually influence the decision making around this project. So that involved working with a lot of different stakeholders, with our commissioners, with different departments, and really knowing what is our lane and what is the lane that community can really drive change and influence. The second thing we wanted to do is disrupt the lack of transparency by closing the loop on some of those feedback cycles. So giving people access to know how their voice influenced the decision and where it didn't, and also why, right? So if we heard loud and clear, we want X and we're not able to deliver, being really clear and being able to come back to community and say, this is why that didn't work. Also wanted to disrupt the solely extracting from community by considering what could a mutual benefit relationship look like? What can we give back to community in this process? And then finally, disrupting the majority rule decision-making, which often centers dominant culture by leveraging statistical small population best practices. And this really gave us the opportunity to truly center lived experience and then look at it through the lenses of racial and other marginalized group data, which for our county is incredibly small. When you look at the racial demographics of Lane County, it is 88% white. So we're talking about a very small population, and finding the ways to utilize the data and still center it and making it statistically significant was really one of the biggest tasks that we've put on ourselves and our team to do this.
Mhm. Yeah, so this survey really felt like the best mechanism considering the goals in really grounding the work in this equitable lens, as Latife was describing, that the survey gave us the most freedom and flexibility to really demonstrate some of these strategies while trying to engage community voice and perspective to inform the work. So I wanted to take a little time to explain more detail about this survey. We'll be throwing a link in the chat that lets you actually go review the survey on your own. We won't take too much time actually showing it to you, but wanted to explain some of our intentionality in designing it. So the content of what we actually asked folks, because this project, ranging from building something from the ground up, understanding how it gets licensed and operated, and then just the act of providing 24/7 crisis services to individuals in behavioral health. There's many aspects to the work. It's quite nuanced. So understanding what and how do we actually, where can we actually garner community input in this in a meaningful and implementable way. So we started by linking up with the summarized content from those listening sessions that I described to help provide some parameters around the type of content that we would be asking about. So, what we heard from our community when we asked essentially, what matters to you? What do you want to speak to? Is that we heard that folks wanted to help advise how treatment is delivered, including referrals, intake, and discharge planning. They also wanted to inform our approach to how we serve individuals with pets. That was a popular piece of feedback that folks really cared about speaking to further. They're also interested in informing the aesthetic and the look of the facility, and then providing input around how our team could ensure that historically and culturally significant elements of our area, our region, and our community were well represented throughout the building design and also the program design. And then lastly, our community wanted to have a say in how we continue to come back to them and what that ongoing community input would look like. So that is what came from those listening sessions as topics that folks identified as yes, these are the things that really matter to us that we think you need to listen to us about. So that is what we use as kind of our guiding direction on what sort of questions to develop. And then we stood up a committee that had individuals with lived experience within the behavioral healthcare system, also individuals on Latife's team who have expertise around diversity, equity, inclusion, and belonging. And then we had some folks with technical skills around actually the science of crafting survey questions and also understand data analysis so that we could be crafting these questions in a way that would actually derive meaningful data from their responses. And we had some epidemiologists as some of the experts serving on that committee to help us really think about how we were crafting these questions. And so our goal when we identified, keeping the survey short enough that folks would actually choose to participate and complete it, how could we prioritize questions that really reflected themes that came from our previous listening sessions, while also emphasizing aspects and details of the project that are truly flexible or implementable. So we wanted every question, any response that was derived from that question, we wanted to be sure that we could incorporate that response. So that means we couldn't ask folks about, you know, licensing or different aspects that are really determined for us, for the project team, by larger regulatory bodies. Because it doesn't matter what we or our community members want in some instances, that's what the law says we have to do. So we were not going to ask about something that would be kind of a dead end with feedback. We also didn't want to ask about decisions that had already been made. This was somewhat into the project and there was still much to do, much to weigh in on. But it felt like risk of that box checking mentality of we're not looking for feedback to confirm what we've already decided. We're looking for feedback to inform what lies ahead of us. So had some parameters and intentionality around what we asked about. And then just really on the logistical level, ensuring that the format of the questions we asked, as I mentioned before, would actually produce the type of data that we could do something with. So we had a range of how we structured the questions, thinking about including multiple choice, ranking order, which we had some of our representatives with lived experience explain that rather than being limited to just choosing one response on a question, it felt helpful to them to actually be able to rank priority and importance, knowing that many options on some of these questions felt equally meaningful. And so we had some like select your top 3 or rank these 4 in different orders or select all that apply. And then we did try to manage the balance of including as much free text opportunity as we could, knowing that as intentional as we were, as we tried to be in developing these questions, we might miss something in how we asked or what we asked, where somebody might be coming to participate in this survey with something really kind of hot and heavy on their mind that they wanted to share, and didn't have a question that would really solicit that. So the tricky part with free text is that it does become a bit more difficult to analyze on the back end when we look at data and trying to understand a comprehensive view. But it was important to get legitimate voice in the written word of the participants of the folks taking the survey. So we did incorporate that throughout, and then of course ended with a question of, hey, in general, what did we miss? Is there something else that matters to you that you really want to speak to? And we did have a little disclaimer at the beginning of like, we're hearing you, but here's our limits on what we can and can't do with your information and with your input. And you deserve to know that there's limits to that. But here's where we can really incorporate your perspective and why we're asking. And then the last step was about vetting the question. So really checking for readability and accessibility, prioritizing a 6th grade reading level so that the survey was accessible to all the folks that we hoped could participate in taking it, and then having just a few additional eyes to check for what we've missed. So we'll throw that link into the chat. I'm not looking to see if, oh, Latife did. So if you check out the link that Latife shared, if you scroll down, that's the page on our Stabilization Center website that highlights all of our community voice efforts. You might need to scroll down a little bit for the results of the survey, but there's a link there that shows you kind of a summary of the data, which we'll actually be getting to here in a second on how we produced that. But at the very bottom of that document is a sample of the survey itself.
So getting back to intentional designing of the survey, I mean, one of the things that we wanted to do is really collect demographic data in a way that allowed us to again, like I said, with the small population data, allow us an opportunity to truly analyze it with those demographics. So one of the things we try to do is ensuring that people had the opportunity to self-select labels. So the opportunity to consider intersectionality, both in their response and also in how we were analyzing the data. We recognize that oftentimes labels are assigned to us, and that can really reinforce stereotypes or sometimes oversimplify some of the very complex identities that people have. So by designing it in a way that people were able to select all that apply, one, it gave us a lot of information in one question. Two, it forced us to also look at it through that lens of intersection. So this little survey design fix really went a long way for us. So for our survey, we also categorized lived experience with people that have had lived experience in navigating the behavioral health system, the legal system, and being unhoused. And for the marginalized group, we categorized those that selected race, gender identity, or sexual orientation. So it allowed us to really bring people together. But I think the most important part is that people got to self-select, and it also moved away from some of the binary ways that we usually collect information, like you must be A or B or C, and really invited people to share about themselves in a way that felt, in a way, safer. So the survey distribution, we wanted to be really strategic about how the survey was distributed, right? So creating this beautiful design survey and spending all the time designing it doesn't really matter if it doesn't get to the hands of the people who we want to be hearing from. So we worked with community partners to develop the survey distribution plan, and we made some goals on what percentage of people we felt like lived experience needed to hear from in terms of some of these categories. And we landed on 70%. So we decided with a committee that it felt about right to have 70% of respondents having had lived experience. And again, lived experience in those three things of behavioral health system, legal system, of being unhoused. And our strategic distribution efforts used a tiered approach. So looking at what are all the ways that we distribute things universally, right? Our website, our social media, email serve list, where it just sort of goes out. But then taking it up a couple of steps and thinking about, okay, we also have a lot of community relationships. How do we leverage those relationships and work with community partners to help distribute some of these surveys, particularly for some of these communities that we often don't hear about as much? So we leveraged those one-on-one relationships. We were really mapping out relationships throughout the organization, like who has relationships with this organization, who might be best to send those communications out. And then finally, our tier 3 was, how are we really going to make sure that we're hearing from people with lived experience? So this was a really interesting model where we partnered with a local organization to distribute a survey in a one-on-one way, but also even having some of our volunteers and members from the committee go to the library and offer that survey distribution on a one-on-one basis. It really served as an opportunity for us to think about the distribution efforts in a way that was more both strategic and also differentiated based on the different needs that people have. We also made sure that the survey was translated into Spanish, which is the highest language other than English spoken in our county. And you can see some of the outcomes actually before I move on. So 70% of our respondents were people that had lived experience. We had 1% of individuals that identified as part of a systemically marginalized community based on race and ethnicity, and 16% based on gender identity and or sexual orientation. We also wanted to make sure that we analyzed the survey in an equitable way. So what we were looking at is, how do we take this demographic information And again, look at it through that intersectional lens to be able to justify decisions using evidence and using statistical analysis. So for this data, we wanted to analyze it and visualize it in 4 different ways. We wanted to see, okay, how did all respondents do and how did they answer on every single question? Then we wanted to see how that group compared to folks that had lived experience. And then we also wanted to see people that identified as having a marginalized identity. And then finally, looking at it through the lens of both people that have both lived experience and a marginalized identity. And we wanted to make sure that we weren't just making inferences about people and that we were able to really support it through data and through statistical significance. We also used this as an opportunity with our committee to test our assumptions and ask ourselves questions like who suffers when we make inferences that are not supported by evidence. And when we talk about evidence, it's really rooted in statistical significance. So here are some of the questions that we were exploring with the community, and the community meaning the committee that Brittany was able to bring together. Are there statistically significant differences between all respondents, people with lived experience, people that self-identified being part of a marginalized community? When do we need to look at additional comment section to gather more information, right? There was a lot of text embedded in many of the questions, but when do we have to pay particular attention to that? So using data to draw us into more detail. When or how have our assumptions been challenged by the evidence provided, right? Particularly when we're comparing different groups and we're like, oh, that is really interesting. This group offered answers that were significantly different than this one. Why might that be? And then finally, do we feel confident in our recommendations or do we need to seek additional information? So are we ready to make a recommendation or do we need to go out and actually gather more evidence before doing that? So modeling how we should be looking at data with community and how we can act or respond to the results of that data and how we make collective decisions about next steps and recommendations. So data literacy was our community offering. So one of the things we talked about in being in mutual relationship with community and not just extracting from the communities that we're seeking voice and feedback from, we thought that data literacy was a piece that we can really try to sort of navigate and figure out how do we do that. So we identified data literacy as a place that we could really increase capacity with our community partners. We anchored on the principle and made sure to get an internal team and to plan for these efforts, right? We had different area expertise experts coming together to really bring this to community. So having content excerpts from 3 different departments and divisions, so behavioral health, data and analytics, our equity office. So while it wasn't like a direct, like equitable offering, we felt good about being able to bring this into that space and spend enough time with community really unpacking the data together. And it felt like we were doing something meaningful and giving something in return.
So I wanted to take a little bit of time since we've highlighted so much of how we intended to make the survey results implementable. How have we actually implemented some of what we learned? And as I described before, of course, this project is complex and nuanced. So most of these action items are ongoing or we are in the middle of them, despite the fact that the survey ended quite a few months ago and the analysis process did. So, and if for those of you who have or will take a peek at the survey itself, you can probably guess where some of these recommendations, which questions kind of generated these. But one implementable action step that we are pursuing is including alternative health services such as massage, acupuncture, spiritual health, basically beyond what you would consider in the traditional healthcare resources within primary medical care and even behavioral health into the standard treatment planning. So this isn't necessarily offering these services in the crisis center itself as the duration of time that folks will spend there is meant to really be focused specifically on de-escalation. So it's briefer period of time and then taking the time to get them rooted in kind of their ongoing long-term care. But this recommendation was really centered around when you all are pursuing the treatment planning options, be sure you ask clients, is there an interest or a need in some of these less traditional, more alternative healthcare services? And this was, again, through all of the lenses that Latife described and how we weighted and prioritized the responses that we received. This is one that we heard from folks with lived experience and those identifying as being a part of a historically marginalized population as an important part of what they would hope to receive if they were to come or send a loved one to these services. Another item is the recommendation that the individual, the staff person who is serving as the first point of contact, first greeting somebody who walks in or is brought into the Crisis Stabilization Center, has specific training unique to the role, which might seem kind of like a no-brainer, but there was some additional elaboration here from folks that they were recommending that the first kind of line of interaction is somebody who has training in trauma-informed care, de-escalation, empathy and compassion, anti-racism training, bias training, and that's an individual that's really well informed about the full range of service offerings at the Stabilization Center. And folks also recommended that kind of first line of interaction is somebody who has lived experience themselves, which, without getting into too much detail about the model of the Stabilization Center itself, there is absolutely an intention to include peer support specialists throughout the program. So there was a recommendation from our community that perhaps a peer or somebody who has that lived experience is one of the first folks that someone would interact with when they're presumably coming in the midst of their crisis and kind of in that heightened state. We even had recommendations from community members that we ensure that this position is certified and credentialed to be able to bill for services, which we appreciate. And we're absolutely thinking that way because that's very crucial to the financial sustainability of this program. But it was cool to hear community members recognize and care about that as well and recommend that. A third recommendation was around developing a work group to research best practice for caring for pets of those seeking crisis services. So I've already called this one out as it came up in the listening sessions as a prioritized theme. So we then did ask some specific questions around supporting individuals in crisis who are accompanied by their pet or by their animal. And this was actually one of the questions where we included a lot of room for free text, and a lot of people took advantage of that. There was pages and pages of written content for our committee to analyze and review. And by applying the lenses and asking ourselves the questions that Latife just reviewed with you all, really the best option to move forward was we need to dedicate a group of experts and folks with really vested interest in this topic to explore this further. What we pulled away from from these survey results around this topic is this is so layered and so nuanced, and people care so deeply about it that it deserves more time and more research and review than our survey committee can offer. So the outcome of that has been to stand up another committee, another focused work group that includes individuals from our local humane society, our local animal control, as well as more individuals with lived experience, and then folks that work within the healthcare system and understand the regulatory side of this piece too. But the big takeaway is that this conversation really matters and needs some more time. And then one of the last kind of implementable pieces that's currently in motion is along a similar vein, and that's to stand up an art and culture council. So similarly to standing up this dedicated work group for supporting pets, folks definitely confirmed that having specific carved out and intentional ways of honoring the historical significance of our local region within Lane County, and then cultural significance of those who have come before and those who are here now as a part of our community is essential to include in the facility design and the artwork, and then also in accommodations required for the program design and actual offering of services. So we took that feedback and that significance that was communicated and kind of summarized that into this action item of standing up a designated arts and culture council. And that work group or that council will also work in close conjunction with Lane County and actually back again, probably with Latife's team around efforts that are already in motion to specifically improve relationships with our local Indigenous community, and will really be coupled with a lot of the work that's happening there, but then more specifically focused on our program and other kind of nuances and subpopulations that we want to represent well within our work. So this is just kind of a smattering of example of some of the implementable work we were able to pull from these results. So we wanted to wrap up our time here in talking about some of what we have learned, we being Latife and I and the team that we represent, taking some time to really look back and examine, and even getting to put together this content to share with you all was a good point of reflection, and like what worked well and what should we do again and what kind of fell on its face and how should we adjust that. So looking at some of what we identified as working really well and things that we would love to replicate was a lot of what Latife had shared with our distribution efforts and our targeted outreach, and the fact that we were able to really emphasize getting the survey out to people that maybe wouldn't necessarily have a chance or the invitation or even the awareness that this sort of opportunity to give input exists. I did peek and see in the Q&A, which I know we'll get to later, there was a question around the reality that some community voice can include NIMBYism or folks saying not in my backyard. I think one way that we navigated a NIMBYist, if that's a word, perspective, how we navigated not having that be dominant is by who we actually pursued and giving the survey to. And certainly the folks that completed the survey might have their feelings about that similarly, but we were intentionally seeking out by, going to areas under some of our local bridges where folks are hanging out, and some of the unhoused camps that we have, and as well as the library and the other places Latife mentioned. So that was really intentional in getting the survey into hands of folks that don't always get that opportunity, that we don't always get to hear from. And then also that every aspect, beginning from the content of the survey, how the questions were structured, how that was distributed, and then how it was analyzed and recommendations were generated, was all informed by a community-based work group of and consultation outside of just the perspectives that Latife and I bring to the table, and that we had the voice of lived experience, not only completing the survey, but in guiding the process throughout. And lastly, that we were able to identify objective ways of reviewing the data in a really intentionally equitable way, and that this was not just kind of putting the healthcare stamp on top of what we heard and filtering it through what we already know, but we were positioned to be open to new ideas and new concepts that could be funneled through a very intentional and fair process, really grounded in the data that we were reviewing, and partly because of how we constructed those questions, thinking ahead to how we would want to view the answers so they could really produce data that we could do something meaningful with.
And we had a lot of opportunities for improvement. We'll focus on 3 here. The first, which, from my lens and jumping into this project and supporting this project, is really thinking about the scalability of this process countywide. So one of the questions we were left thinking about is this process a sustainable process that could be scalable and implemented across all of Lane County? The effort took a lot of time and a lot of cross-departmental collaboration, and it was really beautiful, but really thinking about, is this doable? as a county-wide practice, and there's a lot there to explore for us. The other piece is we took the time to translate the survey and even took time to identify some of those community relationships with with Spanish-speaking organizations. We didn't have more than a handful of respondents using our survey. So that to me demonstrates that we still have a lot of work to do in order to strengthen the relationships between our government entity and the Spanish-speaking community. And then finally is the measurement of the value added, right? We kept going back to, we don't want to just extract, but were the efforts to give access to all of the data to community members, were the efforts to do this data literacy piece with our committee, were those useful? While we heard a lot of positive feedback, we didn't quite capture the different ways and measure the different ways in which we did add value to the community. We want to know if we did and how we did that and where all of that can then go next. So those are three pieces that I would say we would do differently next time.
Yeah, and I think we're gonna transition just with our 9 to 10 minutes remaining here to some questions that I believe Lauren will facilitate for us. But I just want to give a shout out as I've been kind of just peeking at the Q&A as we've been talking. I noticed a lot of questions about the Crisis Stabilization Center itself, and we're happy to talk about that. I'm happy to talk about that. I'll just say that the intention of what we are bringing today is really more about how we have um, attempted to try to bring community voice to the project rather than presenting about the project. But happy to dig into that too, but would encourage questions about the process, the survey, the data, and the community voice as well. I'll hand that to you, Lauren.
All right. Hello. Excuse me. Okay. So I'll start with the only question that's been upvoted. And they asked, so it's a lesser restrictive alternative, all voluntary, or crisis responders can involuntary detain their danger to self, others, grave disability court hearings?
This is a question that comes up so often in our community around this project as well, and understandably because it matters. So without going, and it takes hours to answer this question because there's a lot of layers. So I'll just give you a heads up that this will be an unsatisfactory answer to you for that. But essentially, the model will include an involuntary component. The intention for that is to truly operate as no wrong door and be able to receive someone in any state. But really, the intention in being a person centered, trauma informed facility is to provide a more behavioral health trained focused alternative to other involuntary programs that exist, such as the hospital. And also to create an environment where someone can transition to stay voluntarily as soon as possible, that they would be, engage in a space and a mental space, a physical, emotional space where that's something that they would really choose to participate in.
Thank you. The next question, could you talk about the biggest concerns expressed by community members regarding the impact of the center on the community and how you address these concerns?
Yeah, I can take that one as well. Thank you for that question. It's been a range because it kind of depends on which population within the community we're talking about. Because I would say different members of the community that represent different populations, such as like the business community, the unhoused community, families and schools. Each of those populations kind of have different perspectives around this resource, but there have been concerns that a program like this may draw a crowd of folks that some might determine to have a negative impact on the overall safety of our community. So it's been a lot of, as far as our response to that concern, and that kind of falls into that NIMBY camp as well that I touched on earlier, and that was referenced in the question before. A lot of our response has been an emphasis on the services and actual treatment and options that we will provide. The facility and the program does come with services around transporting individuals once they have stabilized and we have a game plan for what's next, actually providing transportation and support to get them to the next step. So it's not really intended to be a service that draws somebody and then shoos them out the front door where they might linger because they don't have an option. So just really clear education around the treatment model and the support itself. And then I have just been open for one-on-one conversations. And that's been a lot of addressing community concerns. And we're, I guess, a small enough community to perhaps where I can do that. But being available through that comment and question box on the website, and then just making myself available to grab coffee truly and be able to talk through some of the nuance of some of these more complex situations that folks have concerns about.
The next question is, what funding opportunities aided in establishing the Crisis Center?
It's still in process of being fully funded, but at this point, we have secured grant funding, we have some state funding and some federal dollars. These programs are popping up all over, and it's been interesting to see how folks are getting creative in funding them. There are some general fund dollars through various counties, as it's often the counties that are standing them up. But it's been a patchwork of federal, state, county funding, and then local grants, and some intention for some philanthropic donations hopefully coming as well.
And I know you touched on this earlier, but I'm just going to ask the full question again, just in case we didn't cover everything. But community input is so important, and an overemphasis on what the community wants in housing development has created a system driven by the NIMBY, not in my backyard. How do you balance community input with well-informed design?
Mm-hmm. Yeah, in addition to what I've already said, as far as seeking out a well-rounded community voice, so it's not always just the loudest or those that have the most access to speak, but using tools like this survey to seek out voices that we don't necessarily always hear, so we get more of a balanced perspective. And then it's done in tandem with education to the community about what's true about mental health and about the stigmas that exist, and the realities of how prevalent behavioral health, mental health needs are in every single one of our own circles and families. I've had many, again, one-on-one conversations with folks that might be in the NIMBY camp, who, as we talk, we find out we both have some shared experience of loved ones who have navigated similar difficulties. And we just find kind of what's human about one another, and recognize that these are situations where folks are just in need of help. And we're here to provide that help.
Absolutely. That's kind of touching on what Esme said in the keynote, just about normalizing these conversations like amongst each other and continuing it further in the community so you can get programs like this, done. There's a few questions about children at the center. So one is all ages children, and the other one asks is what type of programming will be in place for children and adolescents to keep them busy.
Mm-hmm. Yeah, and I think I saw other questions about length of time too. So, this is really meant to be a short-term de-escalation. So while youth, children, and adults might stay for multiple days, the focus on their time is really about restoration, treatment, and services. So it shouldn't be a program where they are there long enough to need any alternative sort of like access to education or anything there. It's not a long-term residential resource in that way. I will say conversation is happening right now about how to accommodate families. And what if a newly postpartum mom comes in with her baby, her infant, and she's navigating a behavioral health crisis, and our system is not structured to support those situations well. So those are like currently in motion conversations around how we can license and actually provide services in a safe way that accommodates that full range of need across the age spectrum. So.
All right, and we're just out of time. So there's a few more questions, but unfortunately we can't get to them today. But thank you so much, Brittany and Latife. This was wonderful. And I see that the chat is very active as well as the Q&A. So I know that everything you shared definitely resonated. So thank you so much.
Thank you.
Thank you.
Now.